We have over 10,000 new cases, 102,000 total tested positive, 14,000 hospitalized. The frontline battle is in the healthcare system.
A deadly pandemic has cut a swathe through America's biggest city, and Filipino nurses are in the heart of the battle.
Filipino nurses are very friendly, we're very caring.
150,000 nurses from the Philippines make up the largest foreign contingent of healthcare workers in the United States. But for some, the American dream has become more like a nightmare.
It's like you're going to the war zone every time you work.
And the pandemic is just the latest challenge they're facing.
False promises of where to work, false promises of being paid prevailing wage, false promises of working conditions.
101 East meets the Filipinos saving American lives.
And it's so eerie because nobody goes out now, so the streets are so quiet. All you hear are just the sirens, the ambulance.
Lyra Catalan is a nurse at New York's Cola Rehabilitation and Nursing Care Center.
Building A, B, and C. So I work in the C building.
It's America's largest long-term care facility. Lyra's lived in New York for 8 years. In March, she was meant to be visiting family back in the Philippines. But when the pandemic hit, Lyra was stuck in her New York apartment instead, where she started getting alarming messages from colleagues.
This is the cheap stuff, and we had to treat people that are contaminated with coronavirus.
And make our own head mask.
And this is how we expose ourselves and take a lot of chances every day.
I would hear a lot of things from the hospital, so I was scared for myself. I don't want to be part of the statistics. I don't want to die. I mean, my kids still need me.
Cola has denied any lack of protective equipment for its staff. But Lyra was still worried enough to take matters into her own hands, raising money on social media for extra protection.
We were able to raise 1,600 something. And I bought face shields and N95 masks to give out to my co-workers in the unit. I work with people...
Armed with her supplies, Lyra returned to the job she loves, caring for patients.
This one in our PPE.
She also keeps photos from the life she left behind.
What's this one about?
That's my team in G Money Bank.
Lyra was a senior bank manager in the Philippines before retraining as a nurse in order to move to the US. She'd set her sights on providing a better life for her family, even though it meant leaving her 3 children behind with her mother.
My ex-husband was here already in 2005, so the plan was to migrate with the kids. If I migrate as a banker, it would be hard for me to work here. But if I'm a nurse, it would be easier.
Lyra found 2 nursing jobs in New York and began working up to 17 hours a day. Her 2 sons have since joined her, and she's desperate to protect them from the virus.
When I go home, I already take off my scrubs. Actually, in the parking lot, I already take it off. I don't care if somebody sees me.
No matter how many precautions she takes, nursing in New York is now filled with anxiety. Lyra says when she had to pursue one of her dementia patients into a COVID-contaminated ward, she forgot to put on protective gear.
I was exposed like maybe 2 minutes or 3 minutes inside, so I'm kind of paranoid. That's why I had myself tested yesterday. If there's no COVID...
Lyra's test results came back negative, but showed she had already been infected earlier. While she had no symptoms, her friend Gemma wasn't so lucky.
When I had a fever for 2-3 days, I went to the hospital.
Gemma Pena Balactus, another Filipino nurse, works on a COVID-19 ward at Elmhurst Hospital in Queens. It's in one of the poorest and most ethnically diverse areas of the city, and it's been the epicentre of the pandemic in New York. Gemma and her family live near the hospital. For the past few months, death has been all around them.
At that time, there was no testing for staff.
And simply getting tested for the virus wasn't easy.
It was raining that day, and the line for the testing is so long. So the supervisor told me, you just go home because you might get much sicker if you wait for your turn to be tested. At first, I was thinking, oh, what if I got...
Gemma was feverish and sick for 2 weeks. It was COVID-19.
I really had the coronavirus.
And how did you feel?
I was so scared. I was so scared thinking that my family was with me in the apartment and we don't have the PPE. And the apartment is just like a 2-bedroom apartment. It's small, you know. So I stayed in the room and my husband was the one taking care of me. Like he's bringing everything that I need in the room. And my children were instructed to just stay in another room. Okay man, okay na.
Her friends in the Filipino community, like Jason Pacheco, were worried about more than her health.
She wasn't sure whether or not she was going to get paid for her sick days or the days that she was in quarantine. There was a nurse who were telling us...
Jason knew Gemma before she came to the US. She nursed his dying father back in the Philippines, and they've remained close ever since.
Medyo pababa na. Pero COVID pa rin eh.
When he heard Gemma was sick, Jason also organised a fundraiser to help cover her expenses.
This sort of heroism, like I can't do what they're doing out there in the front lines. And having a face that I could put in front of all the news and the heroism that you hear, I just had to do something.
It was so kind of him to do that. Yeah, he's awesome.
Gemma and her husband Michael were thrilled when they moved here 3 years ago.
Yeah, back in the Philippines, I just saw New York like in the magazine and in the movies. But when I got here, it feels so amazing that I was really in New York. Like when I got a picture of me in front of the Empire State Building, I feel like this is it. I'm already in the US, yeah.
Even so, the COVID-19 crisis in New York made them question their decision to move here.
I was scared to go back to work actually. I was thinking of resigning because, you know, having this experience of coronavirus is very traumatic.
But Gemma's brush with the virus has now made her even more determined to help others.
It has impacted a lot because, you know, nothing on earth is important except life. So I have to take care of my patients because having this experience, I know how they feel. It really gives me the courage to really look after them and take care of them.
Filipino nurses' characteristics of being industrious, very polite, very dedicated and committed to their work.
Leo Felix Gerardo is Executive Director of the Philippine Nurses Association of America and a Professor of Nursing at William Patterson University. He says the Philippines' deep commitment to the profession began over 100 years ago during the US occupation.
At that time, there were many soldiers, American soldiers in the Philippines, and they started training Philippine nurses to take care of the US soldiers.
After World War II, the system intensified as the Americans set up more training programs and a new visa system allowing Filipino nurses to easily move to the US. By the late 60s, Filipino nurses were heading all over the world.
The Philippine nurses were celebrated as ambassadors because of how much they have contributed to the Philippine economy. They improve the livelihood of their families. They were able to send members of their families to school, and they were able to improve their way of living.
Today, the Philippines is the largest exporter of nurses globally. New York even has its own Little Manila, and it's estimated that 25% of the Filipinos who live in New York State and the surrounding area work in healthcare. They come in search of a better life, but the pandemic has made it a more dangerous life.
I think I miss most his presence. Whenever he was around, he always gave such a comforting smile. So him not being here is hard because now we realize we have to be that for each other. So.
Denise and Alan's father, Ali Guillermo, died of COVID-19 in early April. He'd worked at the same hospital on Long Island since he moved to the US 16 years ago.
I always bonded with him through our love of photography. This one he took while he was on a shift in the emergency room with some of his colleagues.
Ali passed away in the same ICU ward where he'd been caring for infected patients just a few weeks earlier.
They say that he brought around like a presence with him where you could trust what he's doing. Like not even just the nurses, but the doctors, they confide in him to, reassure themselves. And it just really showed that he was really good at his job.
Yeah, you must be very proud of him.
Yeah.
Ali had been intubated and put on dialysis in a desperate attempt to save him. His children saw him in the hospital before he died.
It was hard to see him all swollen and stuff, so it was just a nightmare to see him in that way, and it was very hard. I wouldn't wish for any kid to see their dad in that state. It's terrible.
It also just it reminded me of how fragile he really was.
Ali's funeral turned into a moving show of support from his co-workers, emergency workers, and the Filipino community.
I always knew that my dad was a hero. As a nurse, he's always helping people. Now that he's really recognized as a hero, it just means so much more.
Ali Dennis Wemmel, New York.
Outside the White House, activists held a grim roll call of the nurses like Ali who have died of COVID-19 across the country.
Covina, California.
Nursing unions are demanding help and equipment to prevent more nurses from dying.
If you don't protect us, we can't protect our patients.
Filipino-American nurses have been disproportionately affected. By the end of June, nearly 50 had died already. Leo Felix believes there are several reasons.
Many of our Filipino-American nurses work closely at the bedside. In our more recent surveys, it showed that at least 60% of Filipino-American nurses work in acute care, critical care.
He believes this puts them at higher risk of being infected with COVID-19. But there's another more complex factor at play too, what Leo Felix calls the bamboo ceiling, which hinders Filipino nurses who try to get promoted off the wards into more senior positions.
Filipino nurses are very respectful and very obedient to their employers, and they didn't really question authorities. So they're seen as less assertive, so they may not necessarily get those positions of management.
He says these traits also make them vulnerable to unscrupulous employers. One group of nurses turned to lawyer Oscar Michelin for help in a bitter legal fight against their employer.
The weight of the case was not just that they were facing a year in prison, it was that they would be deported.
The fight was against New York's biggest nursing home network, Sentosa Care. When Oscar's clients were recruited in the Philippines, they signed up to work at specific nursing homes. But when they arrived, they found themselves working elsewhere, in breach of their visa conditions.
What happened was they were moved to other facilities that were owned by the same global corporation, but were not the name listed on their direct hire applications. And then when they got here, they had other issues with respect to how they were treated, how they were paid.
The nurses say they were overworked, underpaid, squeezed into crowded housing, and denied insurance. When they eventually quit their jobs in 2006, pro bono lawyer Felix Vinluan tried to start official investigations both here and in the Philippines. But Sentosa intervened.
They were able to engage a senior U.S. senator from New York, Chuck Schumer, to write letters to the Philippine consulate that ended up stopping the investigation in the Philippines. The letters went all the way up to the president of the Philippines.
What happened next was extraordinary. Local district attorney Thomas Spota charged the nurses and Felix with conspiring to harm their patients. Oscar then took up their case and argued that the entire prosecution was unconstitutional.
By saying that it was a crime to quit your job, essentially the prosecution violated the 13th Amendment to the Constitution, which of course prohibits slavery and involuntary servitude.
Some of the nurses' contracts also contained exit penalties. That meant if they worked for Sentosa for less than 3 years, they had to pay the company $25,000. Oscar argued these were illegal penalties, unrelated to any actual financial loss suffered by the company. As the case dragged on, it took a heavy toll on the nurses.
They were depressed, they were distressed, they were despondent, they were extraordinarily concerned.
Across the country, the Filipino community mobilized in support, led by groups such as the Philippine Nurses Association of America.
We raised funds for them. We raised legal funds. We supported them by joining rallies, supporting them in court.
When the appeals court finally made its ruling, the nurses won on all counts.
And what was the mood that day?
Festive is the best way to describe it. They felt their lives were handed back to them. It was a huge weight lifted off of everybody. If they would have come home convicted of that charge, it would have changed their lives entirely. They would not have been able to work in healthcare in the States or the Philippines. So everything was riding on this criminal prosecution.
Oscar says in a later civil case, Sentosa ended up paying the nurses a confidential sum in an out-of-court settlement.
All of these companies, they have a lot of money behind them. Immigrant nurses generally don't. Going up against a very, very large opponent is daunting for anyone, particularly for somebody who's here on an immigration visa.
Archiel is a nurse who was recruited from the Philippines a couple of years ago.
Efforts to stop exploitation intensified.
Share her story.
At this health conference, former Sentosa nurse Archiel Boagas spoke out.
I know that there are still a lot of foreign educated nurses out there who have the same and even worse experiences than ours. And this has to stop. Most nurses that are in this dire situation are afraid to speak because they're scared to be deported.
Emboldened, more immigrant nurses are taking their fight for fairness to the courts, including an ongoing class action case against Sentosa. With employers on notice, the biggest fight at the moment remains COVID-19. But not everyone agrees bringing in more nurses is part of the solution.
I would push back against the notion that importing doctors and nurses is essential. I don't think it's essential.
Jason Richwine is a conservative immigration analyst who believes America needs fewer, not more, foreign nurses. He says data shows American hospitals are actually laying off staff during the pandemic. As elective procedures decline, the nurse unemployment rate is rising.
Before the pandemic, it was 0.9%. But in April, which is the most recent data we have, it had gone up to 4.3%. So I'm not really sure where these new nurses, if we were to import new nurses, are going to be working.
Jason insists the recruitment of foreign nurses is really driven by hospitals wanting to keep salaries low.
When someone claims a nurse shortage or a farm worker shortage, what they're saying is, I don't want the wage to rise. I want it to stay right here at this level. And therefore, well, I can't find anybody. If we were to stop importing nurses or doctors, then what would naturally happen in the marketplace is you would have more native-born people going into those professions.
In the midst of the pandemic, Jason's argument is getting short shrift. Despite the anti-immigrant mood in America, some politicians are arguing for more foreign nurses.
Thousands of immigrant health workers are suffering because of a serious problem in our immigration system.
The US healthcare industry is lobbying Congress to urgently approve an extra 25,000 green cards for foreign nurses. The bill, brought by high-ranking senators such as Illinois' Dick Durbin, has bipartisan support.
Our bill would quickly allocate these visas to doctors and nurses who can help us today in the fight against COVID-19.
But the Philippines needs their nurses too. With coronavirus infections surging and nurses in short supply, President Duterte has lashed out at America for luring them away.
So, ngayon nangangailangan kayo ng nurse, express. Kami naman dito nakakabuhan kasi wala kaming pangbigay kasing laki. Di pupuntahan sila. Ang problema ito, itong Amerikano. You could have relied on your own human resource.
But Filipino nurses can earn as much in one day in New York as they can in a month back home. And that's hard to resist.
If we could work at home and earn as much, we wouldn't leave anymore. I mean, why sacrifice seeing your kids?
As night falls in New York and Lyra catches up on sleep, halfway around the world in Cebu, Lyra's daughter Ia is starting her day.
Hiya! Hi, Mom! Kamusta? I'm good. Ikaw? You just woke up? Oo.
Ia Bunal knows the sacrifices her mother has made. She was left behind in the Philippines when Lyra moved to the US.
Wear masks lang. We always wear masks here. Well, except today now, we went to the laundry. I forgot.
For Ia, it's been a stressful time.
It's just really hard to be away from your family at the time when they're sick and you can't be there and you can't really do anything over the phone.
Ia is now old enough to appreciate why her mother left, but it wasn't an easy childhood.
At 15, as soon as she left, I was really forced to grow up to become an adult. I became sort of like a mother to my brothers, and I would get the remittance, go to the bank, do the groceries. And then when I learned how to drive, I also brought my brother to school, and if there was a parent-teacher meeting, I would be the one to go.
But the sacrifices brought opportunities as well.
Me and my brothers get to do what we want in life, and it's because of her, really. So I'm really thankful, and I hope that I could emulate her courage and her strength.
Inspired by her family, Ia is studying to become a doctor and also plans to move to the US. And she's not alone in wanting to continue the Filipino tradition of healthcare. Back in New York, Gemma's daughter Michelle has also been inspired by her mother.
She's a strong woman. I look up to her. She helps people every time and then takes care of us at the same time. It just amazes me.
Michelle has decided to follow her mother into nursing.
I love the idea of it because I like helping people.
Ali Guillermo's son, Alan, also plans to work in medicine. And this next generation of healthcare workers is taking pride in the Filipino nursing diaspora.
It's great how much the Filipino community is able to have an impact on everyone. It should make the Filipino community proud because it shows how much of an influence we're having on the world right now.
Each night at 7 p.m, New Yorkers have been cheering on the healthcare workers from their windows. Appreciation for them is at an all-time high, and Filipino nurses are taking a well-deserved bow.
They appreciate the work that we do, so it's very nice. It's so fulfilling.
I don't know that we ever, before this, really took time to think about the sacrifices that they make when they leave their country and they leave their family and come here to fill jobs.
This is my ultimate dream, to come and work here and bring my family here.